Okay. Tanisha, would you do a quick roll call, please?
Yes, Chairman. I'll begin with Norman Boyd.
Here.
Roger Folsom.
Here.
Russ Childers. Russ Childers. David Cruz.
Good morning, I'm here.
Mark Trail.
Trail is here.
Anthony Williamson.
Here.
Kenneth Davis.
Here.
Russell Crutchfield.
Present.
And I'll repeat again, Russ Childers. Thank you, Chairman. That concludes my roll call.
Okay, we do have a quorum to continue. Call the meeting to order. We have an agenda this morning that is a brief agenda, but one item that we will discuss and be asked to vote on regarding proposal for final adoption. With that meeting being called to order, first order of business is the minutes from the January 14 meeting, and I'll ask our Vice Chairman, Roger Folsom, if Mr. Folsom has read the minutes and would recommend approval.
Mr. Chairman, I have read and reviewed the minutes and would make a motion that they be approved.
Is there a second to that motion?
Crutchfield, second.
Russell Crutchfield has seconded. All in favor say aye.
Mr. Chairman,
Aye.
before we vote, could we have a discussion, please, sir?
Certainly, Mr. Trail, go ahead.
I have one correction to make on the motion that I made to table the now in comp favor at the time. Was qualified that we would be awaiting feedback from CMS. That's not captured in the minutes.
Is that is not properly represented in the minutes? Is that what you're saying?
Yes, sir.
Okay, we will ask that the minutes be revisited and revised, and we'll take them up at the next meeting. Thank you. Any other comments or questions regarding the minutes of the January 14 meeting? Hearing none. Next on our agenda will be the Commissioner's report, and I will turn it over to Commissioner Berry.
Good morning, Mr. Chairman and members of the board. I have one update this morning. Miss Alana Cummings is needing to retire from the board, and I wanted to read a commendation from Governor Kemp by the governor of the state of Georgia, a commendation. Whereas Miss Alana Cummings has served the Georgia Department of Community Health DCH Board of Directors with distinction since her appointment on October 2011 and reappointed in July 2019. Ms. Cummings retired from the department's board of directors in December 2020. And whereas Ms. Cummings' dedication to the well-being of Georgians and their communities has been demonstrated by her actions on the board. And whereas Ms. Cummings' service as secretary of the board of directors and professional experience as a healthcare executive and in information technology has helped guide the board in strengthening the DCH operational efficiencies. And whereas Ms. Cummings' tenure as a board member demonstrated vision, integrity, and balance during an important and transformative period in the department's history. And whereas Ms. Cummings has established herself as a leader for the state of Georgia, it is an honor to recognize her for her service and wish her continued success in all future endeavors. Now, therefore, I, Brian P. Kemp, Governor of the state of Georgia, do hereby commend Ms. Alana Cummings. In witness thereof, I have hereunto set my hand and caused the seal of the executive department to be affixed this 10th day of February in the year of our Lord, 2021, Governor Brian P. Kemp. Ms. Cummings, thank you so much for your service, and we will miss you dearly. Mr. Chairman, that's my update for today.
Thank you, Commissioner, and I'm sure I can speak on behalf of the board that we had our thanks to a really fine person, Elena Cummings, for the service that she has given our board and served as secretary of the board. With that, we will move into the main agenda item for today. And it is an item that was tabled from the last meeting. And I'll ask Lynette Rhodes, Executive Director of Medical Assistance Plans, to present the comprehensive waivers program. And at the conclusion of that, we will be asked to consider this for final adoption. So Lynette, please proceed.
Thank you. Good morning, Chairman Boyd, Commissioner Berry, and board members. Just want to confirm that you all can hear me.
Yes, ma'am.
Okay, great. To recap.
A little bit louder would be appreciated. Thank you.
Okay, no problems. To recap for the attendees, the Comprehensive Supports Waiver and the New Options Waiver programs provide community-based services for individuals with intellectual and/or developmental disabilities. Both waivers are 1915C Medicaid waivers, which must be renewed every 5 years. As previously noted, the Comprehensive Supports Waiver expires at the end of March and must be renewed. While the New Options Waiver will not expire on the same date, the waiver will be amended to incorporate all applicable changes. An opportunity for public comment was held on November the 18th of 2020 at 10:30 a.m. via WebEx. Written comments were due on or before December the 14th of 2020. A summary of the public comments was presented during the January 14th board meeting. As noted by Mr. Trail, the board agreed to table their vote on the matter to allow the department an opportunity to obtain additional guidance from the Centers for Medicare and Medicaid Services and to address the board's outstanding questions. The outstanding questions pertained to the limits placed on the number of skilled nursing hours an individual may receive and the limits placed on the amount of additional staffing hours an individual may receive. We are proposing to limit the number of skilled nursing hours to 16 hours per day, and we're also proposing to limit the number of additional staffing hours to 6 per day. We also proposed, Chairman Boyd, 4 exceptions that will allow an individual to exceed those proposed limits. The 4 exceptions are as follows. The first is that an individual has an active criminal court order, which requires specific staffing requirements beyond the proposed limits. The second is that an individual has transitioned from an intermediate care facility or other institution within the past 6 months and requires additional staffing. The third is that an individual is in the process of transitioning from a crisis home or other crisis setting and has an assessed need for additional staffing. And the fourth exception criteria is that an individual has a documented history of being incapable of living with others due to challenging behaviors that present significant risk to himself or herself or others, as validated by a DBHDD assessment. Since the January board meeting, we have spoken with the Centers for Medicare and Medicaid Services regarding the proposed limits on the number of skilled nursing hours and additional staffing hours. CMS did not pose any objections to the proposed limits or the exception criteria. I will now shift to the outstanding questions posed by the board during the January board meeting. Before shifting into those questions, I do think it is imperative to note that our mission and our goal is to ensure that we are providing access to services to as many people as possible within the confines of our budget. Today, board members, there are 7,000 individuals on a planning list that are desperately waiting to receive services. Again, 7,000. Many of these individuals are high risk. What does this mean for the Department of Community Health and the Department of Behavioral Health and Developmental Disabilities? It means that we have to make changes in order to improve and increase access to services, specifically as it relates to the 7,000 individuals who are unable to receive any waiver services today. How will the current members be impacted by the proposed changes? Some of the members will be impacted. As previously mentioned, per the provisions of our transition plan, members who are receiving skilled nursing services or additional staffing services in excess of the proposed limits will be reassessed to determine if they fall within one of the 4 exception criteria. If the individuals meet the exception criteria, they will be allowed to exceed the proposed caps. For those individuals who do not fall within the exception criteria, we are proposing various alternative options. One of those options is called shared services. This is in essence a situation where roommates can combine their resources and share the staffing. The second option is a group home setting. The third option is a host home setting, which is typically 2 individuals. And the fourth option, if available, again, if available, the family may be able to assist with filling the gap. And this is done frequently in our elderly and disabled waiver. While the preferred method would have been to grandfather in our current waiver participants, CMS has made it abundantly clear that grandfathering is not permissible. One of the questions from the board was whether or not the proposed limits are temporary. The response is no. The proposed limits will remain in place for the duration of this approved waiver period. Thus, this is not a time-limited or temporary approach. The board also asked, why were we taking this approach instead of defining a level of care criteria? After a thorough review of all options, we have determined as an agency that this is the best approach to ensure that we are providing access to as many people as possible. By way of further explanation, the level of care as it relates to the waiver speaks to whether or not an individual is eligible for the comp waiver, not a specific service within the waiver. Once the level of care is determined, each waiver recipient undergoes a clinical assessment to determine which supports he or she is eligible to receive based upon the description of the service. Both DCH and the Department of Behavioral Health and Developmental Disabilities have the discretion to develop a service array to meet the needs of the IDD population. And the comp waiver includes several categories of support services. As a reminder, DCH has proposed a transition period, again, of 18 to 24 months. While we have asked for 24 months, it is important to note that CMS's current policy as it relates to transition periods is to allow for 18 months. Thus, we will have to see where CMS ultimately lands on this issue. DBHDD will designate a utilization manager to assist the regional field office staff in working with individuals in the transition planning. Exception criteria assessments will be completed in order to determine next steps for all of these individuals. And again, shared community living supports is an available option, along with group home living, host homes, and again, if the families are able to fill the gap. Finally, the approach that Georgia is taking with respect to the proposed waiver changes is consistent with other states. Thus, in closing, I hope that our responses or the information provided today is responsive to the board's question. In closing, we are requesting final adoption from the board.
Thank you, Lynette. Are there questions or comments from the board, please?
Mr. Chairman, this is Mr. Trail. I do have a question or two.
Yes.
Whether to Ms. Rhodes or others. Certainly understanding the importance of funding waiting lists and so forth. Do you know what budget requests have been made, particularly in 20 and 21 budgets, or 22 budget even now, by the BHDD to fund the waiting list, or is this the only strategy?
So I do know that DBHDD is looking at this matter. I don't have for you, Mr. Trail, the exact numbers or the exact amount of what their budget request may have been, but they are definitely aware of this and are taking the necessary steps.
Okay, all right. So we really don't know if they've made a request or not.
Mr. Trail, this is Frank Berry. We do understand, and we can get the dollar figure. We understand that they have proposed 200 waivers that are being considered by the General Assembly now for fiscal year 22.
200 waiver slots, I presume you mean?
Yes, sir.
Okay. All right, if I could. So to be clear, as I'm seeking for my own understanding, there's no legislative mandate to date or OPB directive to make these cuts. Is that correct?
Not that our department is aware of.
Okay. And we still don't know, based on previous questions, really exactly what the fiscal impact of this is going to be. We're guessing it's, well, I think $8 million. I don't have the numbers right in front of me. But because these assessments haven't been done, we really don't know what the impact's going to be at this point. Is that correct?
That is correct.
That is correct. The Department of Community Health does not.
Yeah, I understand. So then one other, I guess, observation I will make, or actually two, if you don't mind. One is the other states. I've been told that Oregon actually does allow 24 nursing care, and South Carolina, a neighboring state, allows 23 and a half hours. I'm sure there's a reason behind that, but at any rate, so if I could ask a procedural question, whether of the chair or of the commissioner or possibly someone else in the room, we have before us the proposed final notice, which is the same notice that we got in our original meeting for folks to make their public comment. And then we've been given that same document, but in other notes, we're told that there's some substantial changes to that. For example, the exceptions and so forth were not actually in the original notice. So this is kind of a technical question. If we were to provide final adoption of this notice, is it of the notice that we were provided as a document for this meeting, which is the revised notice? Puzzling question. That's why I'm puzzled.
Mr. Trail, this is Catherine Ivey. I'd like to go ahead and answer that question if I might.
Certainly.
The only significant change to version 1, if you will, and version 2 of the waiver program is the level of detail in the transition plan itself. We spelled out in much greater detail exactly what the transition plan would entail in the second version of the waiver, specifically a period of 6 months in order to completely reassess all impacted waiver members. And at that point, after that 6-month period, we would know exactly how many members would be impacted in terms of needing to make different choices. In other words, how many members might qualify under the exception criteria. We then begin working on it. So that was the most significant detailed change.
Well, if I might follow up on that, then the actual exceptions were not in the original public notice, were they?
Yes, sir. They were actually in the original waiver application, which I'm calling version 1, and that's what was posted with the public notice.
Okay, I'm sorry, that really doesn't answer my question. If we're to adopt the public notice that was sent out for public comment did not include those exceptions. So I'm kind of left with that perception. Mr. Chairman, if appropriate, I'll yield for the time being for other members.
Thank you. Any other questions, comments?
Mr. Chairman, this is Russell Crutchfield. I have one procedural question. Still, I'm kind of fuzzy too, as if what version this is. If it, and this is quite possibly a question for you, Mr. Chairman, from procedure. If it's the same version that was tabled last time by the board, if we want to consider this, do we have to then untable it? We have to vote to untable it, and then we have to vote for approval or not, or right? Because if it's the same version, we tabled that version. So if someone has to take it off the table, then we have to consider it. I don't know. I'm asking for your guidance on that.
I think from a procedural standpoint, tabling means we tabled it for further consideration and discussion. It does not mean that we rejected that proposal.
Well, we tabled it pending CMS guidance.
I think
which hasn't happened.
Our consideration for the proposal is for us. Any other questions, comments? If none, I will make the proposal that we approve for final adoption and ask for a second to that motion.
This is Ken Davis. I'll second that motion.
Dr. Davis has seconded. All in favor say aye.
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 Opposed?
Opposed.
Let the record show that Mr. Trail has opposed. Abstaining? So the motion has carried with one no vote, and that is Mr. Trail. Thank you very much, Lynette, for your presentation. Next item on the agenda is, I believe, Commissioner, did you have some comments, further comments?
Thank you, Mr. Chairman, and members of the board, and most importantly for our families that sent in hundreds of letters. We at the department, I personally read every single one of them. You have our commitment that between the two departments, the Department of Behavioral Health and Developmental Disabilities, along with the Department of Community Health, we will work with you personally to ensure that your loved one continues to get the absolute best care. If that is with you on an ongoing basis, we will support that. If that does happen to mean that a change is in the future, we will do everything possible to make that transition as easy for you as possible. We understand these are very difficult decisions to be made. And as the chairman said, and as Lynette said, there are large numbers of individuals. This is a difficult day, but it's also an exciting day for us to be able to begin to think about those 7,000 people that are on the current planning list and the 2,000 on the short-term planning list that are in desperate need of care. This is, again, a very challenging discussion. I understand that, and a very challenging change that we're making. And our commitment is to continue to work with you and for you. Mr. Chairman, I'll yield to you. Thank you.
Thank you, Commissioner, for those comments. And I know I can speak on behalf of the board that we extend our appreciation for all the people that took time to make public comment to this. And as board members, we have also reviewed those comments. Thank all of you for your participation today. Is there anyone that knows of any new business that needs to come before the board at this time? Hearing none, I thank you again for your participation today. Recognizing we're moving into a President's Day weekend. That will be recognized on Monday, and if you haven't bought your Valentine's yet, it's time to do that as well. Our next meeting will be on March 11, and thank you very much. Have a good day.
Thank you.